I saw a lot of unfortunate things, that included young women that were pregnant and who were left intubated and sedated in an ICU with COVID, and the question of their future and their child's future was sometimes left unanswered. Hello everyone, I'm Dr. Brandi Sinkfield. I am the founder of Women's Digital Health. I was a fellow in digital health at Stanford University in 2015, and so Women's Digital Health is just an extension of the work that I did there. And I'm going to tell you some reasons why I started it and why I started it now. So as an anesthesiologist, during the height of the pandemic, I made a lot of assumptions as a digital health fellowship. When I was in fellowship, I saw a lot of fancy marketing pitches. Everyone was going to save the world in 2015. And so when 2020 hit and the pandemic crisis happened, I thought all these fancy marketing pitches that I heard would manifest into saving and helping a lot of people. And that did not happen. I was sadly disappointed. Thankfully, we had telehealth at least as one lifeline to connect people to healthcare. But aside from that, I was left with a lot of answers, questions about where does technology show up when we really need it. And so one of the reasons I founded Women's Digital Health is to bridge the gap between people who have existing technology that works and women who really need them. The second reason I started Women's Digital Health is to focus on women's health. I saw a lot of unfortunate things, that included young women that were pregnant and who were left intubated and sedated in an ICU with COVID, and the question of their future and their child's future was sometimes left unanswered. I saw a growing mental health epidemic manifest in young girls as young as 12 and 13 in the form of high blood pressure, high diabetes, high levels of anxiety that sometimes our healthcare systems right now are not equipped to manage. And I just watched the tears and the jaws clench of my fellow obstetric and gynecology colleagues when the overturning of Roe v. Wade happened, and they were left having to do this job with no support and a lot of silence. And they also knew that this was the very beginning of a change in how we manage women's health. So I started Women's Digital Health with the interest of, one, educating our young women and educating our people who love women. If you don't have education, it's very difficult to consent. And in healthcare, we call that informed consent. If you are not informed, you can't consent. And so Women's Digital Health was founded to improve your education, your knowledge about yourself so that you can consent. The second part of this is to improve your knowledge about technology. There's a lot of investment that is needed in women's health, and to make our mark with technology is a great place to start. Bridging the gap between what we know about our bodies and what exists in technology is a great way for all of us to move forward, to say, hey, we care about women and we care about how technology can help women. And that's why I started Women's Digital Health.